Every chiropractic physician is apt to come across from time to time a family member or a patient who seems particularly challenging to their practice. Four things to keep in mind for that physician. First is to identify that patient. Being able to recognize that a patient may be dissatisfied or concerned about a particular issue or aspect of their care, and to be able to know that there's a person or patient who may need some additional time and attention in treating them. So identification is the first important issue. The second is to then be prepared to actively help manage that patient. And by that I mean being able to understand that that patient, because of their concerns, may need some additional time for an appointment. You may want to consider scheduling that patient at perhaps earlier in the morning or at a particular time of the day when you know that you can give that patient some of the time and attention that that individual needs. An overriding consideration here is to communicate. That patient may have concerns or challenges, and in order for you to best manage your patient and provide the best chiropractic treatment for him or her, you need to communicate with them, try to understand what their concerns are. It may really have nothing to do with you or the care that they're getting in your office. There may be a family issue, there may be a personal issue. And then the fourth consideration for patients that you sense are difficult is documentation. Take the time to document your records about your interactions, about questions and statements that perhaps your patient has made to you, and about the efforts that you've made to address their care and the services that you've rendered to them. And lastly, always keep in mind that there may come a point where you feel that you are not able to provide the type of care that your patient needs of you. And there's always an opportunity then to perhaps tell your patient that it may be in their best interest that they seek care with another practitioner. If you're considering ending your relationship with your patient, look to your board rules for any guidance that is provided in your state for how you best need to communicate the termination of that relationship.